Cancer is one of the leading causes of morbidity and mortality worldwide, with approximately 14 million new cases in 2012. The number of new cases is expected to rise by about 70% over the next 2 decades. Cancer is the second leading cause of death globally, and was responsible for 8.8 million deaths in 2015. Globally, nearly 1 in 6 deaths is due to cancer. Approximately 70% of deaths from cancer occur in low- and middle-income countries. Around 1/3 of deaths from cancer are due to the 5 leading behavioral and dietary risks: high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use, and alcohol use. Tobacco use is the most important risk factor for cancer and is responsible for approximately 22% of cancer deaths, too. Cancer-causing infections, such as hepatitis and human papillomavirus (HPV), are responsible for up to 25% of cancer cases in low- and middle-income countries. 3. Late-stage presentation and inaccessible diagnosis and treatment are common. In 2017, only 26% of low-income countries reported having pathology services generally available in the public sector. More than 90% of high-income countries reported treatment services are available, compared to less than 30% of low-income countries. The economic impact of cancer is significant and is increasing. The total annual economic cost of cancer in 2010 was estimated at approximately $1.16 trillion. 4. Only 1 in 5 low- and middle-income countries have the necessary data to drive cancer policy. 5. Cancer is a generic term for a large group of diseases that can affect any part of the body. Other terms used are malignant tumors and neoplasms. One defining feature of cancer is the rapid creation of abnormal cells that grow beyond their usual boundaries, and which can then invade adjoining parts of the body and spread to other organs. The latter process is referred to as metastasizing. Metastases are a major cause of death from cancer. Cancer is a leading cause of death worldwide, accounting for 8.8 million deaths in 2015. The most common causes of cancer death are cancers of lung, 1.69 million deaths; liver, 788,000 deaths; colorectal, 774,000 deaths; stomach, 754,000 deaths; breast, 571,000 deaths. Cancer arises from the transformation of normal cells into tumor cells in a multi-stage process that generally progresses from a precancerous lesion to a malignant tumor. These changes are the result of the interaction between a person's genetic factors and 3 categories of external agents, including physical carcinogens, such as ultraviolet and ionizing radiation; chemical carcinogens, such as asbestos, components of tobacco smoke; aflatoxin, a food contaminant; and arsenic, a drinking water contaminant; and biological carcinogens, such as infections from certain viruses, bacteria, or parasites. WHO, through its Cancer Research Agency, International Agency for Research on Cancer (IARC), maintains a classification of cancer-causing agents. Aging is another fundamental factor for the development of cancer. The incidence of cancer rises dramatically with age, most likely due to a buildup of risks for specific cancers that increase with age. The overall risk accumulation is combined with the tendency for cellular repair mechanisms to be less effective as a person grows older. Tobacco use, alcohol use, unhealthy diet, and physical inactivity are major cancer risk factors worldwide and are also the 4 shared risk factors for other non-communicable diseases. Some chronic infections are risk factors for cancer and have major relevance in low- and middle-income countries. Approximately 15% of cancers diagnosed in 2012 were attributed to carcinogenic infections, including Helicobacter pylori, human papillomavirus (HPV), hepatitis B virus, hepatitis C virus, and Epstein-Barr virus. 3. Hepatitis B and C virus and some types of HPV increase the risk for liver and cervical cancer, respectively. Infection with HIV substantially increases the risk of cancers such as cervical cancer. Between 30 to 50% of cancers can currently be prevented by avoiding risk factors and implementing existing evidence-based prevention strategies. The cancer burden can also be reduced through early detection of cancer and management of patients who develop cancer. Many cancers have a high chance of cure if diagnosed early and treated adequately. Modifying or avoiding key risk factors can significantly reduce the burden of cancer. These risk factors include tobacco use, including cigarettes and smokeless tobacco, being overweight or obese, unhealthy diet with low fruit and vegetable intake, lack of physical activity, alcohol use, sexually transmitted HPV infection by hepatitis or other carcinogenic infections, ionizing and ultraviolet radiation, urban air pollution, indoor smoke from household use of solid fuels. Tobacco use is the single most important risk factor for cancer and is responsible for approximately 22% of cancer-related deaths globally. 2. Prevent cancer. People may increase avoidance of the risk factors listed above, vaccinate against HPV and hepatitis B virus, control occupational hazards, reduce exposure to ultraviolet radiation, reduce exposure to ionizing radiation, occupational or medical diagnostic imaging. Vaccination against these HPV and hepatitis B viruses could prevent 1 million cancer cases each year. 3. Cancer mortality can be reduced if cases are detected and treated early. There are two components of early detection. When identified early, cancer is more likely to respond to effective treatment, and can result in a greater probability of surviving, less morbidity, and less expensive treatment. Significant improvements can be made in the lives of cancer patients by detecting cancer early and avoiding delays in care.